Hello, my name is Dr. Mrs. Edna Asamoah Ejari, the medical superintendent for Akuse Government Hospital. Akuse Hospital is located in the Eastern Region in the Lower Manya district. It's a small hospital, but then we run all the services that are run in the district hospital. We have all the four various departments and wards. We have a kids ward, we have a female ward, we have a male ward, and then we have a maternity ward. And then we run other services like the OPD, antenatal services, BCT. We have an ultrasound machine, we have an X-ray machine, we have an ECG that we use to run our services. So Akuse Hospital, with our catchment area, because of the unique nature of our location, we don't serve just Akuse Township. We serve other districts as well, not just the Eastern Region. We are close to the Volta region, so we serve clients coming from the Volta region. We are close to Accra, to Sudoku. So we serve clients coming from Accra, Shire Sudoku. We serve clients coming all the way from Tema. So with our catchment area, we end up serving clients from all around based on the unique nature of our location. So this is a very, very old hospital. It was built in 1911 by the Germans. During those days, I think the Akuse Township was a very busy trade area. They were actually trading across the Volta, so it was very busy trade, and then we had a lot of foreigners and expatriates coming here to do business. So the Germans built this facility mainly for their staff and for their construction workers. It was previously managed as a clinic. So when they finished with their project, they actually handed it over to Ghana government, and then our government converted it into a hospital, so that we can actually run all the other services that I mentioned. Unfortunately, because it was originally planned to run as a clinic, it has a lot of challenges to date. Almost every department I've mentioned has a challenge. So to start with, as a clinic, they actually built a very small theater to be used for minor procedures, clinic procedures and all that. But when it was converted, automatically that theater had to be used as a major theater for all the major cases that we do here in the hospital. We currently do all surgical cases you can think of, almost all the obstetric emergencies, to mention a few. We do the cesarean sections here, we do myomectomies, we do hysterectomies, we do ectopic pregnancies with the surgeries, we do the hernia repairs, we do the laparotomies to explore and examine the abdomen. So we do virtually everything. The only cases that are referred are the very complicated cases that will need ICU care after surgery. So for those ones, we are forced to refer to higher facilities for the specialists there to handle, and then after which they can get access to the ICU services there. And with the challenges in Akuse Hospital, to start with, it's a very old hospital, so a lot of the infrastructural work is old, 1911. I'll start with the wiring system. Actually, management has had a lot of battle with the effect that the old wiring system keep having on our equipment. Because of that, we keep getting frequent breakdown of equipment. We keep replacing a lot of the vital and expensive equipment that we use to run our service. And management is actually planning on rewiring the whole facility, which is actually very, very expensive. One challenge is because it's an old hospital, the kind of block work they did in the facility is one of the toughest. So we keep bringing artisans to have a look at it. And they actually advise us that it's better we do the whole thing new again, because breaking and then rewiring is going to cost us more than rewiring it anew. but because there isn't enough IGF, it is still a challenge to date. So the equipment that we commonly use are BP machines, cardiac monitors, phototherapy machines. Most of these have actually broken down, and it's making our service delivery a bit challenged for us. So for the kids, one of the most important things that has broken down that is so expensive, is difficult to replace, has to do with our phototherapy machine. It has finally broken down. That's what we use to manage units with issues of jaundice. So it is a big problem for us. For the other units, like I said, things as simple as cardiac monitors. You know, we run service here. So ideally, every unit, like I mentioned, is supposed to have enough cardiac monitors to monitor the inpatients and then the patients that are actually recovering from surgeries. So we have issues with that also. Hospital beds has always been an issue because we keep managing and recycling what we have as frequently as possible. How to be replacing the beds, the old ones have to be replaced and renovated and all that. So with hospital beds, we always have a challenge. Then we have what we call ward trolleys. We use for our daily ward rounds. So just like any other thing we keep reusing, we keep getting constant breakdowns, and most of them need to be replaced. And most units don't even have to start with. Yes. With the other things that we need, there are some basic things that we need to add on to improve upon the quality of care that we give to our clients. Things as simple as bed sheets, pillowcases, curtains for the various wards. There are things that we do have, but there are things that we need to be replacing as frequently as possible, because they either get worn out or torn or all that. So yeah, these are things that might keep spending money on to keep the quality of the service up. Now, to improve our service delivery, it was a clinic, and then we are managing as a hospital now. So there are certain services that a hospital is supposed to run that we don't currently have, that we plan on adding on. So for example, we have an ENT unit, which also needs other equipment to support that department. We have an eye unit that we have set up with just the basic equipment, and then equipment like slit lamp, what my eye doctor will use to diagnose diseases like glaucoma, which is very common in our catchment area. It's also a challenge because of the cost implication of getting such a machine to run the service. Management is working on getting a dental unit on board to improve service delivery for our clients. Now, all our dental cases, we need to refer to other facilities. Most of our clients say you refer and they don't go, so they come back with worse cases. So we are planning on getting a dental unit, which we all know is going to be very costly, and that's the only reason why we've not started already. We need a dental chair, we need other equipment in the unit to make the unit compete. No matter how small, basic things that we need to start, we'll be more than willing to start. Other challenges the facility has, we have a very old incinerator which has actually been abandoned. Management is planning on actually constructing a new one. We've gotten the quotations for it, but as usual, IGN has been a challenge. There are a whole lot of other basic things like BP machines. These are things we keep using daily because of the stress on those machines. There are things that management keeps replacing. You use, no matter the number that you buy and push into the system, because of the pressure on it, because of daily usage, it keeps breaking down, and then you keep replacing BP machines, pulse oximeters, basic things like our stethoscopes, our ward trolleys. We have currently gone paperless and that came with its own challenges, because we had to set up computers, we had to set up back up all the computers with UPS and other things now support. The electric wiring, like I said, is very bad, so it keeps worrying these equipment for us. So management's plan is to actually get UPS for all the computers. We've started, but it's very slow because the money is not there. So we have to say, we run virtually all the services that I've mentioned and more. Our challenges, unfortunately, are a lot. So with management support, we are tackling them one at a time. Unfortunately, COVID really affected us negatively. So a lot of the IGF went into procuring essential things needed during this COVID period, which diverted the same bigger IGF to supporting other consumables. So unfortunately, most of these things I've mentioned are still lacking to date. One thing we also need, that we are planning to do to add on to our service delivery, is getting an accident and emergency unit. We've done a lot about it. We've allocated the area, we've gotten our plans ready, and we are currently going around looking for sponsors to support us. No matter how small the support, we'll be very grateful. We want to build, because we don't have the land space, our plan comes as a 2-story. The whole of the ground floor will be the accident and emergency unit. We would have a NICU, a brand new NICU in there. We would have a pharmacy, we would have a lab in there. The first floor would have a conference room big enough to accommodate staff for all our trainings and meetings and all that. We currently do not have a conference room big enough to hold our staff meetings and all our programs and trainings and CPDs and all that. And then the last floor would have our offices there, and then we would have a place designated as a nursery to support our staff, because most of our staff come to work because they have babies and children. The working environment is not so friendly for them, so we management has planned to put that one in there to also support staff. So this is Akuse Hospital, very small, but these are all the services and all the challenges that we have as